Well, herpes is a viral infection or a virus that can infect both men and women. There are two different types of herpes. There's the type 1, which we generally think of as cold sores, and the type 2, which is genital herpes, or the more classically associated as being a sexually transmitted disease.
It's been estimated that between 45 and 60 million Americans are infected with genital herpes, which is roughly 1 in 5 adult Americans. The CDC thinks that about 1 million Americans get infected every year with genital herpes.
At least 60% of the population in the United States will test positive for antibodies to herpes type 1, and 30 to 50% will show positive for herpes type 2.
A significant number of people, it's estimated, have no idea that they actually have ever been infected with the virus. They may have had a very minimal initial outbreak and then just think every now and then they get a little itching, burning, and not even realize that they have the virus at all.
It's generally accepted by most people that that's the only time you have to worry is when you're having an outbreak, but that's not true. Medical science has
a year, because the medication itself, as I mentioned, doesn't suddenly shut the outbreak off. It just decreases the duration and shortens the duration and decreases the intensity. So instead of having a 7-day outbreak, they might have a 5-day outbreak. So the better approach is to suppress the outbreaks totally for someone who has recurrent outbreaks. Someone who has a primary infection and never has another outbreak again, then symptomatic therapy is probably a better approach.